Hi guys, I just wanted to pop on really quick and tell you guys about my hysterectomy that I had done on September 12th. I'm about 2 weeks, a little over 2 weeks out right now. Um, Everything went well. We got back my pathology, which showed that I was stage 1A1. I got clear margins and I am cancer free, and I don't need any more treatment. I just have to do my checks with my oncologist and all that. I go back October 17th, and when I go back they will just do another check, make sure everything's healing well. I already had an appointment about a week after surgery, which turned out really well. Everything was healing the way that it should. Of course, they didn't check my internal stitches, they just checked my external incisions. So for anybody who hasn't watched my previous videos, I had a robotics assisted laparoscopic hysterectomy. So they essentially gave me 6 small incisions, 2 of which are inside my belly button, and they broke everything up and pulled it through the vagina. So they took the cervix, they took the uterus, and they took the fallopian tubes, and I was able to keep my ovaries, which is great because, as most of you know, I am only 26 years old, so I was a little bit worried about the possibility of losing my ovaries this young. But I got to keep them, and that was a huge relief for us. Other than that, I can say this won't be a very long video. I will probably do another video in the future talking about how my next appointment goes and kind of what I'm going to be going through as far as like my checks and everything like that. But for now, I just wanted to jump on and kind of talk to you about how my hysterectomy went. Unfortunately, we had an extremely rude nurse when I woke up. My bladder would not wake up, it would not function, and I don't know if any of you guys know this, but they won't let you leave after a hysterectomy until you urinate. And I was having a lot of pressure, really felt like I had to urinate, but I just couldn't go. And my nurse was extremely rude. That she was in my room with me and my husband complaining about how she had plans that night, but because I was still in recovery, she couldn't leave unless I was either discharged or admitted into like an overnight room and taken out of recovery. So initially they had given me some Dilaudid for my pain, and it had made me nauseous. And she had me hooked up to an IV and was giving me saline through my IV, and then kept badgering me. You need to drink water, you need to drink water. And I kept telling her, I know, but I'm really nauseous. She kept forcing it on me. One of my trips to the bathroom, probably only a couple of hours after surgery, I was on my way back from the bathroom, and I started to vomit in the hallway. And she had like quickly grabbed something that I was throwing up in, but I don't remember what it was because I was still out of it from the anesthesia, really. But so she grabbed it, and I was throwing up into it. And as I'm throwing up, after abdominal surgery, my nurse was like, "You need to keep walking. You can't stand in the hallway," and was kind of like yelling at me and like kind of trying to push me along. And I was just really irritated because it's like, I just had abdominal surgery and now I'm vomiting using those muscles. You're lucky I'm still standing, basically. And then, so I had to have like bladder scans to see how full my bladder was because I had a lot of pressure, but I couldn't go. And if it gets too full, that becomes an issue. They were going to straight calf me and do all these crazy things. But my scans always came back like I didn't have a whole lot in there. Eventually, about 7.5 hours after I got out of surgery, I ended up finally urinating. Finally. And it was only about 100 cc's. And the lady at that point, they had already started like getting a room to admit me for the night. It was probably around 9 o'clock at night at this point. Um, and so we went back to my room, and she kind of just was like, well, you can go home if you want to, or you can stay the night. We have a room for you. And I just kind of looked at my husband, and he's like, well, I think maybe we should stay. Sorry, that's my cat. And so the nurse, real rudely, was like, oh no, it's a really small room. It's an ops room, like an optional room because I didn't have to stay. She's like, there's nowhere for you to sleep. And I looked at her and I said, well, if he can't stay, I don't want to stay. Because I was really uncomfortable at this point. I had been treated very rudely. Plus, I was still messed up from the anesthesia, and just, I really had just no interest in staying if he couldn't stay. And so my nurse walks out, which I don't know if any of you guys have had surgery, but the recovery area is generally just like this small area, kind of like an emergency room, where they have like a curtain that they pull around so that you have privacy. So we could hear everything. The nurse walks out and she's like, well, her husband said that if he can't stay, then she can't stay. Which never happened, mind you. My husband would have been just fine with me saying if that's what I wanted to do. But I had told him, like, I don't want to stay here if you can't stay. Let's just go home. So now it's like 9:30 at night, and they started the discharge process and discharged me, whatever. Well, the pharmacy was closed, so we couldn't get any painkillers, and with the opioid thing, the addiction to opioids that's going on, they cannot let you leave with pills in hand. But they also told me that if they gave me anything, I would have to stay like a certain amount of time. And so, long story short, I ended up being sent home with no painkillers for that whole night. And then the next morning, my husband had to rush out to the pharmacy and get my prescription filled and everything else so that I wasn't miserable. I will say that the first, probably almost the first week, maybe like the first 5 to 6 days, the gas pain was awful. So they pump up your stomach with air so that they can really see and just, move around in there and everything else. And that air gets trapped and it creates gas pains. And for me, I got a lot up under my rib cage, which felt like it was pushing on my lung and made it hard for me it felt really hard to breathe, which I have anxiety, so that kind of flipped out my anxiety a little bit, and it was not fun. It also would come up into like my shoulder blade and my clavicle area, which was uncomfortable, was not near as bad as the pain under my rib cage. So there was the gas pain that was pretty bad. That was probably about the worst of it, really, until 3 days after surgery, I developed a cough, and it was a very bad cough. And I don't know how else to explain it except for like bronchitis. Just like you start coughing and you just cannot stop coughing. Okay, that's what happened. And we're talking days after abdominal surgery. So the coughing was really, really intense and really painful. I ended up going, so I started coughing on Saturday. So I went Sunday, Monday, Tuesday, Wednesday, 4 more days until I had my doctor's appointment. And even though I had called them on Monday, they said that, this can be a side effect from anesthesia. Some people go through it. Well, by the time Wednesday came around, I was still coughing. So they were concerned that maybe I had started to develop pneumonia. So they ordered a chest x-ray, which came back clear, no pneumonia. It turns out I just had a really super bad reaction to the anesthesia. And that's what was causing me to cough like that. My lungs just had a bad reaction to it. So they gave me these like pearl-looking little yellow, they're like circular little yellow pills for coughing, and they worked amazing. So my cough's now gone. My pain is pretty much gone. The glue is starting to come off of my incisions, which It's kind of cool, but it hurts too because it like catches on your clothes, but it's not all the way ready to come off. So then that kind of hurts, but it's also not the worst pain in the world. It's just really freaking annoying. Other than that, I mean, everything's been good. They gave me, I will say, if any of you ladies are going through this and you have to have a hysterectomy, if you don't wake up from surgery with a belly band on, ask for one because it was a lifesaver in the car, in the bed, pretty much everything. Walking, I would take it off, and when I would walk, it would feel like my organs were like jumbling around inside of me, which I'm sure they weren't, but it hurt. So the belly band was a huge lifesaver, but don't wear it all the time. Make sure that you're not like sweating and keeping it on because you will develop, like I developed a rash around one incision where I had to go and get a cream that was like a steroid cream and an antibiotic just in case it were to get infected, that I would have to rub on it a few times a day or whatever. And thank God for insurance, I only had to pay $10 for it, but it's actually a $160 prescription. So try not to overdo it, especially if you don't have that great of coverage for prescriptions. We thankfully, our insurance is very good with dental and prescription, and it's not so great with medical, but we do have it. So, I mean, that is a blessing in itself. Another thing I wanted to just remind everybody is if you're a part of a support group on Facebook because you have cervical cancer or even pre-cancer, don't cling to the horror stories. There are so many good stories out there. You know, women who were stage 3 plus that did their chemo and their radiation and they turned out fine. Unfortunately, a lot of people with good experiences kind of just move on with their life and it's kind of swept under the rug. They really don't share their stories. Whereas people with horror stories, they vent about it, they talk about it more on the internet and things like that. And so that scares us, the ones who are going through it, and we have all these questions and all of these fears, and your anxiety just kind of takes over. If that happens, I strongly suggest that you find a way to get some of those better stories like mine, where I was extremely lucky. It was like 6 years I went without a pap smear, and I finally went in and got one because I was having some problems with my ovaries. I have polycystic ovarian syndrome, and that's what encouraged me to go in and get checked. And while I was there, they kind of said, you should have a pap smear. So we did, and we caught it, but it could have turned out a lot worse than it was. So just try to bear in mind that the horror stories you hear are a lot rarer than they seem to be. Other than that, I don't really have anything for you guys today. I'm going to jump off of here. I just kind of wanted to check in and let you know how my hysterectomy had gone and how I'm doing now. I'm recovering very well. Still can't lift more than 10 pounds, which is kind of hard because I do have a 5-year-old. But it could be much worse, and I got lucky, and I feel extremely blessed, and I want to continue to keep you guys updated and just kind of be a positive aspect of this instead of being another horror story, or just instead of keeping my story quiet and then all that's out there is horror stories. I enjoy being able to document this experience and kind of fill you all in on what I'm going through and maybe give you guys hope or even help you with the what to expect and the not knowing and just something to relate to. If any of you guys who watch this have any particular questions that I'm not answering or anything like that, feel free to send me a message. Feel free to comment on these videos. Look me up on Facebook. My name's Nicole, Nikkole, Berger, Berger. Pretty sure I'm the only one you're going to find. So, honestly, if you have any questions or if you need somebody to talk to or anything, feel free to look me up. Feel free to message me on here, comment on here. I will get back to you. I don't have a huge following right now, and that's okay. I just want to put my story out there and help who I can. So, um, I guess that's it for now, and we will. I'll be back on at another time. Okay. Thanks, guys.